Right, let me ask you something that might surprise you. Did you know that men over 60 who maintain an active intimate life 2 to 3 times a week have a 50% lower risk of heart attack compared to those who don't? I'll bet that's not what you expected to hear when you clicked on this video, is it? I'm Dr. Amelia Wright, and I've been working in sexual health and gerontology for over 25 years. Throughout my career, I've heard the same question hundreds of times from men your age. How often should I be having sex at my age? And more importantly, is there something wrong with me if I'm not? Today, we're going to tackle this question head on. No beating around the bush. No awkward euphemisms. Just straight talk about what the science actually says about sex in later life, what's normal, what's healthy, and most importantly, what you can do if things aren't working quite as they used to. Now, before we dive in, I want you to do something for me. If you're over 60 and you've been wondering about this very question, give this video a like. It helps me understand how many of you are looking for this information, and it tells YouTube to share this with other men who need to hear it. Let me start by addressing the elephant in the room. Society tells us that sex is for young people, that once you hit a certain age, you're supposed to hang up your boots and call it a day. Well, I'm here to tell you that's complete rubbish. The research shows us something entirely different. A landmark study from the University of Chicago found that among men aged 65 to 74, 54% reported being sexually active. And here's what's fascinating. Those who remained sexually active reported higher levels of overall life satisfaction, better mental health, and even stronger cognitive function. This isn't just about pleasure, gentlemen. This is about your overall well-being. Let's talk about what sex actually does for your body as you age. When you engage in sexual activity, your body releases a cocktail of beneficial chemicals. First, there's oxytocin, often called the bonding hormone. This lovely chemical reduces stress, lowers blood pressure, and creates feelings of connection and well-being. Then there are endorphins, your body's natural painkillers. Many of my patients report that regular sexual activity helps manage chronic pain conditions like arthritis. But here's where it gets really interesting. Sexual activity is actually a form of exercise. I'm not suggesting it replaces your morning walk or your swim at the local leisure center, but it does get your heart rate up, improves circulation, and even burns a few calories. Research from the American Heart Association shows that sexual activity is roughly equivalent to walking up 2 flights of stairs. Not bad for something enjoyable, eh? Now, let's address the question you're all waiting for. How often should you be having sex? You want a number, don't you? Something concrete to aim for. Here's what the science tells us. Studies indicate that 1 to 2 times per week appears to be optimal for cardiovascular health and emotional well-being in men over 60. However, and this is crucial, some research suggests that anywhere from once a week to several times a week is perfectly normal and healthy. The key word here is appears. Because here's what I want you to understand. The quality of your intimate experiences matters far more than the frequency. I've had patients in my clinic who have sex once a fortnight and are perfectly content. And I've had others who maintain daily intimacy well into their 80s. Both groups report high levels of satisfaction. The difference isn't in how often they're doing it. It's in how connected they feel with their partner, how satisfying the experience is, and whether their frequency matches their desire. Let me share something important. A study published in the British Medical Journal followed over 3,000 men for 15 years. They found that men who reported the highest frequency of orgasms had a significantly lower risk of fatal coronary events. But here's the twist. The benefit wasn't necessarily about the frequency itself. It was about having a satisfying sex life that matched their desires. Men who wanted sex twice a week and had it twice a week showed the same health benefits as men who wanted it once a week and achieved that frequency. The takeaway: Don't compare yourself to some arbitrary standard. The right frequency is what feels right for you and your partner. Now, let's clear up some myths, because I hear these constantly in my practice. Myth number 1. Sex drive disappears after 70. Absolute nonsense. Whilst testosterone levels do decline with age, many men maintain a healthy sex drive well into their 80s and beyond. What changes is often not desire, but performance, and that's something we can address. Myth number 2. Erectile difficulties mean the end of your sex life. Not even close. ED affects about half of men over 50 to some degree, but there are numerous effective treatments available, from lifestyle changes, to medications, to devices. More on this in a moment. Myth number 3. Only men want sex in later life. This one frustrates me. Research shows that many women experience a renewed interest in sex after menopause. Without the worry of pregnancy, and with children grown, many couples report their intimate life actually improves in their 60s and 70s. Myth number 4. If you're single or widowed, your sex life is over. Not true at all. Self-pleasure is a perfectly healthy and normal part of sexuality at any age. It provides many of the same health benefits as partnered sex, including stress reduction, better sleep, and improved mood. Right, let's talk about the challenges, because I know many of you are facing them. Based on the questions I receive, the most common concern is erectile dysfunction. If you're experiencing difficulties getting or maintaining an erection, you're not alone. This affects millions of men, and it's nothing to be embarrassed about. Here's what I want you to understand. ED is often a symptom, not a disease in itself. It can be an early warning sign of cardiovascular issues, diabetes, or hormonal imbalances. This is why I always tell my patients, don't suffer in silence. Speak to your GP. A proper evaluation can identify underlying health issues that need addressing anyway. Now, what can you do about it? Lifestyle changes make a tremendous difference. Regular exercise, maintaining a healthy weight, cutting down on alcohol, and stopping smoking can all significantly improve erectile function. In fact, a study from Harvard showed that men who walked just 30 minutes a day had a 41% lower risk of ED. If lifestyle changes aren't enough, there are medical options. Medications like sildenafil work well for many men. Vacuum devices, penile injections, and in some cases, surgical implants are all viable options. The point is, solutions exist. You don't have to accept ED as an inevitable part of aging. But here's something I want to emphasize. An erection isn't necessary for intimacy or pleasure. I've had countless conversations with couples who discovered that when they stopped fixating on penetrative sex, their intimate life actually became richer. Oral sex, manual stimulation, using toys, extended foreplay. All of these can be incredibly satisfying. The key is communication and creativity. Let's talk about another common issue: mismatched libidos. What happens when you want sex more often than your partner, or vice versa? This is where honest communication becomes essential. I've seen marriages strain because partners make assumptions rather than having frank conversations. If you're wanting intimacy more frequently than your partner, that's a conversation worth having. Not as a demand or complaint, but as an expression of your needs and desires. Similarly, if you're feeling pressured to have sex more often than you'd like, that's equally valid to express. Sometimes couples find compromise. Perhaps it's about quality over quantity, making the times you do have sex more meaningful. Sometimes it's about broadening your definition of intimacy. Cuddling, kissing, massage. These all release oxytocin and create bonding. And for those of you who are single, widowed, or whose partners are unable or unwilling to be sexually active, self-pleasure is a perfectly healthy option. There's no age limit on masturbation, and it provides genuine health benefits. better sleep, reduced stress, prostate health, mood improvement. These aren't trivial benefits. Now, I want to spend a moment on something that often gets overlooked when we talk about sex in later life: the emotional component. In my 25 years of practice, I've noticed something fascinating. The couples who maintain satisfying intimate lives into their 70s, 80s, and beyond aren't necessarily the ones having sex most frequently. They're the ones who've maintained emotional intimacy. What do I mean by that? It's about feeling seen, valued, and desired by your partner. It's about vulnerability and trust. When you've been with someone for decades, there's a depth of connection that younger couples simply haven't had time to develop. That connection can make physical intimacy profoundly meaningful. Research supports this. A study from the University of Michigan found that emotional intimacy was the strongest predictor of sexual satisfaction in older adults, far more than physical health or frequency of sex. How do you maintain that emotional intimacy? It's simpler than you might think. Regular conversation, not just about logistics, but about feelings, dreams, fears. Physical affection that isn't necessarily sexual. Holding hands, cuddling on the sofa, a kiss goodbye in the morning. Shared experiences and activities. These all strengthen the bond that makes physical intimacy more satisfying. I often tell couples that if you want better sex, start outside the bedroom. Show appreciation, express affection, maintain curiosity about your partner. After decades together, it's easy to think you know everything about them. But people change. Make an effort to stay connected to who they are now. Let me give you some practical tips that my patients have found helpful. First, timing matters more than you might think. Many men find their testosterone levels are highest in the morning. If you're struggling with energy or performance in the evening, try initiating intimacy in the morning instead. I know it might require a bit of planning, especially if you've got grandchildren staying or a busy schedule, but many couples report this simple change makes a significant difference. Second, don't underestimate the importance of setting the scene. I'm not suggesting you need candles and rose petals, though there's nothing wrong with that, but privacy, comfort, and minimal distractions help. Turn off the telly, put away your mobile, create space for intimacy. Third, communicate during sex, not just before or after. Let your partner know what feels good, what you'd like more or less of. This isn't just about better sex, it's about deepening trust and connection. Fourth, use lubricant. As we age, our bodies change. Many women experience vaginal dryness after menopause, but men can benefit from extra lubrication as well. There's no shame in it, it simply makes things more comfortable and pleasurable. Fifth, don't ignore pain or discomfort. If sex is painful for you or your partner, that's not something to push through. It's a signal that something needs addressing, whether that's a medical issue, the need for different positions, or simply more foreplay. Speaking of positions, this is worth mentioning. Arthritis, back problems, or other physical limitations don't mean the end of sex. They might mean adapting. Side-lying positions, using pillows for support, taking it slower. Again, this is where communication and creativity come in. Now, I mentioned earlier that self-pleasure is a viable and healthy option, and I want to expand on that briefly. For men who are single, whose partners are unable or unwilling to be sexually active, or who simply want to maintain their sexual function between partnered encounters, masturbation provides real benefits. It helps maintain erectile function. It reduces stress and improves sleep. It can even support prostate health. There's no age at which this becomes inappropriate or unhealthy. If you're concerned about privacy, especially if you're in shared living arrangements, that's a practical consideration to address, but the activity itself is perfectly normal. Let me address one more concern I hear frequently. What if you're just not interested in sex anymore? Is that normal? Should you be worried? Here's my answer. It depends. A gradual decline in sexual interest can be a normal part of aging for some people. But a sudden loss of interest or distress about your lack of interest warrants investigation. It could indicate depression, hormonal issues, medication side effects, or other treatable conditions. If you're happy with your level of sexual activity, even if that's none at all, then there's no problem. But if you're distressed by changes in your sex drive, or if it's causing relationship problems, speak to your doctor. Often there are solutions. I also want to acknowledge that for some of you, health issues make sex difficult or impossible. Perhaps you've had a stroke, prostate surgery, heart problems, or other conditions that impact sexual function. This doesn't mean intimacy has to disappear from your life. Touch, affection, emotional closeness, these remain possible and important. I've worked with couples who've adapted beautifully to changed circumstances. They've found new ways to express love and desire, to maintain physical connection even when traditional sex isn't possible. It requires creativity, patience, and open communication, but it's absolutely achievable. Here's what I want you to take away from this conversation. First, sexual activity in later life is normal, healthy, and beneficial. Don't let society's attitudes make you feel like there's something wrong with having desires and needs at your age. Second, quality matters more than quantity. A deeply satisfying intimate encounter once a week is worth far more than frequent but disconnected sex. Focus on connection, communication, and mutual pleasure. Third, problems are solvable. Whether it's ED, libido mismatch, pain, or other issues, there are solutions available. Don't suffer in silence. Speak to healthcare professionals who can help. Fourth, broaden your definition of intimacy. Sex is wonderful, but it's not the only form of physical connection. Touch, affection, and emotional intimacy all contribute to well-being and relationship satisfaction. Fifth, you have the right to set your own standards. Don't compare yourself to statistics or other people's experiences. What matters is what feels right for you and your partner. If you're in a relationship, I encourage you to have an honest conversation with your partner about this. Not necessarily right this second, perhaps not even today, but soon. Talk about what you each want and need. Talk about any concerns or difficulties. Talk about what's working and what isn't. These conversations aren't always easy, but they're invaluable. And if you're experiencing difficulties, whether that's ED, pain, loss of interest, or anything else, make an appointment with your GP. Sexual health is health. It's not frivolous or embarrassing. It's an important component of overall well-being. Before I finish, I want to hear from you. Write in the comments, how important is intimacy to your well-being? And is there a specific topic related to sexual health in later life you'd like me to cover in a future video? Your questions and experiences help me create content that's actually useful. If you found this video helpful, please subscribe to the channel. I create evidence-based content about health and well-being for people in the second half of life, and I'd love to have you as part of this community. Remember, gentlemen, getting older doesn't mean giving up on pleasure, connection, or intimacy. It might mean adapting, communicating, and being creative. But a satisfying intimate life is absolutely possible at any age. You deserve pleasure and connection, whether that's with a partner or on your own. Right, I think that's quite enough talk about sex for one day. Thank you for watching, and I'll see you in the next video.